Asenapine, Saphris, Sycrest. Complete drug information. Number 1, generic name, drug class, brand name forms. Generic name, Asenapine. Drug class, atypical antipsychotic, second-generation antipsychotic, SGA. Brand names, Saphris, US, Sycrest, EU, Sycrest, transdermal patch, US. Drug forms, sublingual tablets, 5 mg, 10 mg. Transdermal patch, 3.8 mg, 24R, 5.7 mg, 24R, 7.6 mg, 24R2. Definition: Asenapine is an atypical antipsychotic used in the management of psychiatric disorders such as schizophrenia and bipolar I disorder. It is designed for sublingual or transdermal use because it has very poor oral bioavailability when swallowed. 3. Mechanism of action. Primary receptor activity. D2 receptor antagonist reduces positive symptoms of schizophrenia, delusions, hallucinations. 5-HT2A receptor antagonist improves negative symptoms and reduces EPS compared to first-generation antipsychotics. Other receptor actions, 5-HT2C, 5-HT antagonism, mood stabilizing and antidepressant effects. Adrenergic antagonism may cause hypotension, dizziness. H1 histamine antagonism, sedation, weight gain. Minimal muscarinic, M-mine activity, lower risk of anticholinergic side effects, dry mouth, constipation compared to clozapine, olanzapine. Number 4. Uses: management of schizophrenia, adults. Management of acute manic or mixed episodes associated with bipolar I disorder as monotherapy or adjunct. 5. Indications: FDA-approved indications, schizophrenia, adults. Bipolar I disorder, acute manic mixed episodes, adults and children to 10 years old. Maintenance therapy in bipolar disorder as adjunct. Off-label uses: agitation and psychiatric disorders, studied, not widely recommended. Depression augmentation in treatment-resistant cases, rare. Number 6, contraindications. Absolute hypersensitivity to asenapine or excipients, reports of anaphylaxis, angioedema. Severe hepatic impairment, child PUC. Relative precautionary, QT prolongation or arrhythmias. History of seizures. Risk of metabolic syndrome, obesity, diabetes, hyperlipidemia. Before taking this medicine, precautions. Inform doctor if you have cardiac disease, arrhythmias, heart failure, QT prolongation, liver disease, moderate impairment requires caution, seizure disorders, metabolic disorders, diabetes, obesity, dyslipidemia, orthostatic hypotension or fainting history, pregnancy or breastfeeding, limited human data, weigh risks versus benefits. Elderly patients with dementia-related psychosis, increased mortality risk, not recommended. 8. How to use: sublingual tablets. Place tablet under the tongue, allowed to dissolve completely. Do not chew, swallow, or crush. Do not eat or drink for 10 minutes after administration. Transdermal patch, Sycrest. Apply once daily to clean, dry, hairless skin, upper arm, abdomen, hip, or back. Rotate application sites daily. Avoid heat sources, hot baths, heating pads over the patch. 9. Dosing information. Schizophrenia, adults. Initial 5 mg sublingual BID may increase to 10 mg after several days if needed, max 20 mg per day. Bipolar I disorder, adults. Initial 10 mg sublingual BID may reduce to 5 mg BID if not tolerated. Adjunct therapy with lithium valproate, 5 to 10 mg BID. Pediatric bipolar I disorder, 10 years. Start 2.5 mg BID, titrate to 5 to 10 mg BID. Transdermal patch, 3.8 mg 24R, may titrate to 5.7 mg or 7.6 mg 24R. 10. Missed dose, overdose. Missed dose. Take as soon as remembered unless close to next dose. Do not double up. Overdose symptoms: severe sedation, hypotension, respiratory depression. Extrapyramidal symptoms: rigidity, tremor, dystonia. QT prolongation, arrhythmia risk. Management: supportive care, ECG monitoring, airway management. No specific antidote. Number 11. Stop or avoid taking. Do not stop suddenly, may cause relapse of psychosis or mania. Avoid alcohol and CNS depressants, additive sedation. Avoid smoking initiation or cessation without dose adjustment, induces CYP1A2. Avoid strong CYP1A2 inhibitors, e.g. fluvoxamine, ciprofloxacin. Number 12. Side effects. Common 10%: sedation, somnolence, dizziness, orthostatic hypotension, weight gain, increased appetite. Oral hypoesthesia, numb tongue, taste disturbances. Akathisia, restlessness, extrapyramidal symptoms. Less common but notable: constipation, nausea, anxiety, insomnia, dry mouth, fatigue. Serious neuroleptic malignant syndrome, NMS. tardive dyskinesia, TD, severe allergic reaction, anaphylaxis, angioedema, QT prolongation, arrhythmias, hyperglycemia, new onset diabetes. Number 13, vital information, black box warning, increased risk of death in elderly patients with dementia-related psychosis. Monitor, weight, blood glucose, lipid panel, risk of metabolic syndrome. ECG in patients with cardiac risk, EPS and tardive dyskinesia symptoms. Asenapine bioavailability is much lower if swallowed, only 2% versus sublingual 35%. Number 14, other drugs that will affect asenapine, CYP1A2 inhibitors, levels, fluvoxamine, ciprofloxacin, CYP1A2 inducers, levels, rifampin, carbamazepine, smoking tobacco, QT prolonging agents, amiodarone, quinidine, haloperidol, ziprasidone, arrhythmia risk. CNS depressants, opioids, alcohol, benzodiazepines, additive sedation, respiratory depression. Other antipsychotics, antidepressants, may risk of serotonin syndrome, EPS, or QT prolongation. Thank you. Have a nice day.